Well, I was a little concerned. I was, maybe as a doctor, actually, is better that it was, I could relate more to what was going on because I was trying to notice everything that is going on, so that as a patient, that not only for myself, I would see what other people would be feeling. So I tried to focus on: is this painful? Is this something that vision blocked out by it? All these type of things that could give somebody anxiety. Well, first of all, it's the whole procedure is very quick. So that really helps. But it's also there's breaks given in it. So the doctor will apply the iLux to the eye in different spots on the lids. There's three per eye, and each time it's only done for a minute. So you really have a lot of breaks here. I really was surprised. I was expecting much worse. So I try to talk to my patients and go through that about how it is something that, there's going to be an anesthetic put in the eye, but there's no anesthesia. They're sitting up. There's, the procedure itself is broken up and doesn't take very long. So you get these little breathers. And that was the good part. But when it was happening, I was noticing all that. I really didn't, even though you think I didn't know what to expect. And I think letting the patient know what to expect and having some trust is very important in this. And it's carried through. We've done hundreds of cases, and it's carried through. It's a drop in the eye, and most patients that have been in an office before have had it done because take an eye pressure or to get their eyes dilated. It doesn't dilate the eyes, but there's usually a drop that gets put in that kind of numbs the eye. And so it's a local one. It burns a little when it goes in for about 10 seconds, and then that's it. But it's good that it burns because you know it got in. And then after that, your eyes kind of feel like a little bit, they're just numbed. So, and then during the procedure, you can feel a little bit of heat. That definitely is probably the most noticeable thing about during the procedure because the anesthetic stops any, pressure feeling or surface feeling of the eye, any pain, but you still feel temperature. So you feel it a little bit, but it's nothing that you feel is dangerous. But I could tell you that afterwards, just from a recovery standpoint, it was very quick. I mean, most of the time, the worst case scenario is somebody would feel kind of sore. Their eyes would feel sore for a day or two. And I really had very, very little. I mean, I saw patients afterwards, and if anything, my eyes felt better. But it really took a couple of days for me to really realize, how good this was because the integrity of the tear film takes a little while to build up. If you do something about increasing volume, like either taking artificial tears or even doing the punctal occlusion, there's a more of an immediate effect. But this takes a little bit longer. It's so much better because it's consistent. It's not like intermittent. My original problem with dryness wasn't so much the physical symptoms, it was vision. If I drove for a long period of time, the road signs would get blurry because I'm staring and not blinking. If I was at the computer, I had to do a course for 8 hours a day, virtual for some licensing upgrade. And after a week, I felt like at the end of the day, my vision was just impaired. It was hazy. After this, that got better. In other words, it didn't take it. It was more durable. My vision was instead of putting drops in, where you get temporary relief, it stayed consistently good.